So, some general background information on the historical implications of the establishment of Oklahoma in regards to alcohol use among Native Americans. It takes us back to Trail of Tears when we see Native Americans being forced to relocate, give up their homes in the southeastern states, as well as we see more interaction with European colonists. With that, there was a lot of introduction to more potent alcohol upon their arrival, and it was kind of a medium for fur trade, especially fur that was highly regarded or highly sought after. So these kind of beginning factors set the stage for some pretty long-term generational heavy alcohol use.
So as we see in the picture here, the state of Oklahoma went through different phases of forced relocation, especially in regards to whether the Native American tribe was considered civilized or not. So these 5 civilized tribes are Cherokee, Choctaw, Chickasaw, Creek, and Seminole, which all were given designated sovereign land within the state that you can see in the picture here. And this was kind of a snapshot of the Indian territories of 1830. Now, from 1830 to 1862, we saw just westward expansion as well as the Indian Removal Act in 1830 required that most Native Americans move west of the Mississippi River and into the Indian Territory, which was then, it wasn't the state of Oklahoma just yet, but in 1907 is when Oklahoma became an official state. This next picture, we can see a snapshot of the state of Oklahoma in the year 1855, which was in the middle of the peak of Indian removal of the Southeast. During this time, we saw tribes such as Pawnee, Wichita, Muskogee, the Comanche, other smaller tribes that weren't considered civilized into forced relocation, again, west of the Mississippi River. So after that period, we saw the final phase, which was from 1867 to 1892. Now, during that phase, it just concluded the removal of the Seminole tribe from the state of Florida, as well as the Dawes Commission was enacted, and over 100,000 Cherokee Indians were at the time relocating west of the Mississippi. So this phase, there was a lot of not just legislative processes, but cultural assimilation as well as loss of home and community going on. So at all different levels, society and civilization for Native Americans was being oppressed and persecuted. So that brings me to this third and last snapshot of the state of Oklahoma. This was from the year 1889. And so you can see how there's area where there's no man's land in the pot holder, as you will, of Oklahoma, because it looks like a pot you put on the stove, but that area they declared as no man's land, whereas designated Native American territory increased, as well as was divided amongst smaller tribes that were not the 5 civilized as well. Bringing us to the problem identification of this policy evaluation, we can acknowledge that rates of heavy alcohol use and alcohol use disorders among Native Americans and Indigenous people are amongst the highest rates in the world, especially their youth. The 2017 National Health Survey conducted found that Alaska Natives and American Indians, the adolescents were more likely than any other minority group to develop a risky behavior associated with alcohol, more so than anyone else. And that being said, along with the historical context we just talked about, we can see how the groundwork for such a problem has been made. kind of spilling over into Native American life even into modern times. Besides the historical factors, different contributing factors today, low socioeconomic status, as well as we can look at lack of accessibility, lack of transportation, as well as lack of adequate health services within the Indian Health Service, which is a part of the federal government under the Department of Human and Health Services. So funding there is negligible, as well as the factors at play in their physical and social environment. So my policy evaluation, I would like to address 3 different options and then the policy recommendation moving forward. So first and foremost, education. That's option 1. Creating culturally mindful and evidence-based curriculum is an important process for all students, especially reaching students prior to their initial exposure to alcohol or any substances for that matter. If we can incorporate a curriculum within grade schools addressing substance use and alcohol and talking about the information and even the historical implications behind it, because I'm even curious if students know of how alcohol was even introduced to Native American tribes to begin with. So with that, I mean, that would be very interesting to see if attitudes would change, seeing as how it was introduced in such a risky and unsafe way. So this curriculum would include tools, resources, information just regarding health and substance use education. So kind of trying to address whether students have already had exposure and also maintaining that curriculum throughout the rest of their educational experience. So not just, maybe early grade school, but also middle school and then high school again, not letting it just, fall off, especially at an age group where people are more likely to be exposed to alcohol. That would be very important. So option number 2 includes health infrastructure. That is ambulatory services and different buildings and just any type of health services or health offices that we would need on reservation land that is not already there. We need to meet the demand for Native American health, especially the health disparities involving type 2 diabetes and hypertension and cardiovascular disease. These are like very chronic and generational issues. And, addressing with education is one pillar of this policy evaluation. But in addition, it's just as important that we address health infrastructure and make sure that mental health services are available, and making sure that, just as, a hospital would use electronic health record systems to manage and monitor patient records, having something in place to survey the people on sovereign land to ensure measurable future outcomes. And so option 3 is probably the most significant as far as making sure our stakeholders involved not only see this as important, but also are able to back that up with funding. We need to increase funding to the Indian Health Service. Maybe not necessarily all at once, but over time, generally speaking. This increase, we can not only fund auxiliary programs to further assist Native American youth or even elderly communities within tribal lands, but just having the finances to build the health infrastructure needed, build the education and the curriculum needed, and sustain health over a long period of time. So in accordance with the Center for Disease Control and Prevention's One Health and policy evaluation framework model, we looked at evaluation criteria for this policy, and there were 4 different criteria that specifically needed to be met. That's cost effectiveness, overall benefit and equity, efficiency, feasibility, and the political and social acceptability. So making sure that our stakeholders feel that, again, that this policy is beneficial and have participation across the board for the longevity of the program, which then, of course, brings us to our policy recommendation. So we have our options, we have our evaluation criteria, but what is a policy that we can recommend to, further enhance the Native American youth and also try to establish roots within the community? Well, the one program I thought of was, what if we created a financial aid system within the IHS that subsidized Native American and Indigenous youth who were interested in healthcare professions, and allowing them to be able to go to whatever healthcare education program that they're wanting to take part in, whether they want to be dentists or dietitians or PAs or public health professionals, doctors. We, like, Native Americans, need healthcare workers and they need representation. So what better way to not only combat alcohol use than with also investing in our nation's kids? So I see this as a program that could be beneficial, especially if we incorporate an after component comprising of students having to go back to their rural areas or their sovereign territory where they either grew up or just somewhere that there is a health disparity that is a public health crisis, and committing to employment in one of those areas for maybe 2 to 3 years. This could be a great way to kind of get that, so to speak, pay the payment for the subsidized schooling and training. So this, to me, seems as though a no-brainer. I think that we've seen Native American health being failed since even prior to the start of our nation's founding, and even the state of Oklahoma. They have been forced to relocate, culturally assimilated, introduced alcohol in a way that was not based out of education or out of, conserving it. It was out of celebratory and excessiveness. So, now we see the intergenerational impact that has had, as well as the social and physical environment being affected in a way that may not have necessarily been if this introduction had been done in a more appropriate way. So I think, once again, by and large, it's pretty apparent that we should finally invest in our Native American communities, especially within the state of Oklahoma, and absolutely start to have representation in the healthcare world.